Dr. Smith, physical therapist here, and today I'm going to talk about what's going on in skilled nursing facilities. You've heard of the PDPM changes in SNFs, or skilled nursing facilities, and that stands for the patient-driven payer model. I have made a video, or two videos, about 2 months ago on the patient-driven grouping model and how it's going to affect home health, and we're seeing lots of similarities, and I've had lots of students reach out to me, so I want to address exactly what's going on. We actually have to understand the history of why the model is changing first, though. So therapy in skilled nursing and home health for Medicare patients has been therapy driven, which is why you've had people in home health span full cert periods unnecessarily to get a huge chunk of change. Again, that's going to change in January unless they want to get audited, go out of the business, or you'll see the same effects that we're seeing now happening in SNF. And in SNFs, we're seeing administrators pressure, ultra rugs, pressure more therapy, and we're seeing basically everything being driven by money, not actual therapy need, where administrators have been overriding clinical decisions that therapists made in SNFs and in home health. So we've basically been abused and exploited as therapists by people that don't even have a clinical license. And I don't know why people let that happen. I mean, if that happened to me, I would document it and get an attorney. And if that's happened to you, I recommend that you do that. But we've kind of been pushed over for a long time, but there has been some whistleblower cases, some lawsuits, and so on. And Medicare realized how much money they're throwing away. And because nobody really knows what we do as therapists, though our patients know we provide value, from a payer level, it's much harder to say what therapy has done. Whereas if you compare it to a surgery, you can say, oh, a fusion was done, an injection was done. But when you come to therapy, we do have good outcomes, but it's not as cut and dry of what exactly was done. So that's kind of the driver for the reimbursement cuts. So that being said, they are actually switching to outcome-based measures, which we've seen with the Oasis D in home care. And we're seeing now with the PDPM payer model for SNFs that I'm looking at here from CMS. The issue that we're going to have, though, is now PT and OT are separate than speech, and speech is its own thing. But when we look at the adjustments, is that they're going to want people out of the facility faster, even if they just had a stroke, even if they're really sick, because the faster you get them out of the facility, the higher your payment. So you have 20 days to get 100% reimbursement. And after that, it's going to go down, 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 down. So facilities are not going to want you there because they know that you're hurting their bottom line. But the more concerning factor in all of this is what's happened to rates. So we know in home health from my prior videos that when the change happens in home health, that we're going to get about $1,800 per patient we see per 30 days for the agency. And it can be as low as $1,800 or as high as $5,000 based on if they have diabetes and other factors. Again, this is kind of similar in skilled nursing, but skilled nursing is honestly fucking over therapists. And I'm going to show you why in a second. So when we look at the reimbursement rates for PT, it's $85. So someone with a doctorate in physical therapy providing this service is only going to be reimbursed at $85. That was not the case before. OT 77, PT and OT combined 160. Speech, it's getting fucked even harder. Excuse my language, but I mean $14 for this, like, it's bad for therapists, all kinds. And now that this is all separate, it makes it even worse. Nursing, though, as we see why everything's switching to a nursing driven in the skilled nursing facility, and we'll probably see this in home health too, is that, you know, it's almost $400 for this diagnosis. So I actually will bet you money that most facilities are just going to do what they did with therapy and game the nursing system and pressure clinical judgments on nurses when the person pressuring it doesn't have a clinical license. Because what's going to happen with reimbursements as high as $400 per intervention, of course they're going to game that system. I mean, these have been unethical companies doing unethical things that should have been reported long ago. It has been reported. There's been some whistleblower cases. But, I mean, like, I don't know why you would expect a company that's been doing this for 10 years or more to change. They're not going to. It's going to be after the bottom line. They're just going to find a new way to abuse the system. And that way, if they get audited, they'll just switch over to nursing and so on, which is what we're seeing. So, and again, like, I love my nurses. I have respect for them. And I do think, though, that our reimbursement should be about the same, if not higher, due to the education level. Because you can get a nursing degree in 2 years. You can get a DPT in 7. Master's and OT 6, but there's OTDs as well, 7. So speech 2 masters as well. So it's kind of weird how it's switching. But what's most concerning of all of this is non-therapy ancillary services is more than the PT and OT combined, even if you throw in speech in there. This non-therapy ancillary services, I don't know what that is. I'm assuming that's rehab aid, CNAs, a bunch of bullshit that's not skilled is actually reimbursed high. I don't know if this is for administrators or what this is, but you'll see that these are going to be abused and upcoded. So again, if we look at the money and the shareholder stock and so on, so for example, one big facility that let people go was Genesis, or a company that let people go was Genesis. Their stock went up 7% since the layoffs. So when we actually look at the numbers and see what's going on, I don't know how schools are going to justify, $100,000 plus tuition when salaries honestly may drop. And I'm not trying to say that to scare you or freak you out, but if you have a solid job right now and you're getting paid, I suggest you keep it. However, nothing's really guaranteed. If you want to go into entrepreneurship, go ahead and do that. However, if someone's telling you to start a cash-based business, make sure they're not selling you a course on how to be a cash-based physical therapist. So we're seeing lots of, basically exposure of fraud come to light, and therapists are again being the brunt of it because we never took a stand for ourselves from the beginning. And unfortunately, schools don't teach us that. And it's kind of like we're going to see the same thing in home care. Home care, we're going to see the same thing I talked about in my other PDGM videos, where we see that the reimbursement is no longer therapy driven, but needs. So anybody that is borderline diabetic is going to get an endocrine diagnosis. We're going to see the same thing. It's going to be a whole new system abused in the same way. Medicare says they will audit these companies. I don't know if they have enough people to do it or keep up or actually care, or if they're going to care as much when they cut the reimbursement for therapists so much and next is going to be outpatient. And again, I believe it's because nobody can say what we actually do. And yes, it's documented in manual therapy, neuro re-ed, but these reviewers probably aren't therapists. Maybe a nurse with an associate's degree, maybe someone's best friend from high school that owns the company, which is probably more likely the case, unfortunately. But what we're going to see is that because we can't justify what we do in the way that other medical specialties do, such as injections, interventions, drugs, and so on, that we need to start following more of the military model if we can get those practice rights, because then at least it backs us up to show some primary care prevention, some medication review as in home care, some dry needling in some states. And again, I know it's a younger profession, but we're kind of our own worst enemy in this situation by kind of letting ourselves get pushed over for years, not lawyering up and not being like, fuck you to whoever's telling you to override your clinical judgment. All right, guys, hope you enjoyed this video. If you have any comments, questions, complaints, concerns, comment below or send me a message.